Hello, welcome to my channel Medicine with Dr. Moran. I'm a consultant in internal medicine. Who should take aspirin to prevent heart attacks and strokes? It's a question I get asked a lot by patients. In today's video, I'm going to review the U.S. Preventative Screening Task Force recommendation guidelines on aspirin and the use of aspirin to prevent first cardiac events like a heart attack and secondary events. For patients who have had a heart attack, a stent, a bypass, mini stroke, or a stroke, the answer is very clear that aspirin itself will prevent future events. This is what we call secondary prevention, meaning that it's being utilized to prevent a second event after surviving the first one. The dose of aspirin is a low dose, which means a dose of 81 milligrams here in North America, or the 100 milligram dose often given in other parts of the world, but not the 325 higher dose. But what about taking aspirin to prevent a first event? Who should receive aspirin to prevent a first heart attack or stroke? This is what we call primary prevention or primary prophylaxis. Over the last 30 years or so, many people have taken aspirin on a daily basis, often not on physician's advice. But is it actually worth the risk? Often physicians would recommend aspirin to adults over 50 who have a greater than 10% risk of a heart event over a 10-year period. There are risk calculators that you can look up online to estimate your 10-year risk of cardiovascular events, which are based on criteria such as age, diabetes, high blood pressure, smoking, and family history, and of course lipid values or cholesterol values. Now there's a link to the description below to one of those calculators for those who are interested in finding their 10-year cardiovascular risk. There are many ways you can reduce your cardiovascular risk by improving these risk factors if they're abnormal, or doing things such as eating a healthy diet, getting proper amounts of sleep, and regular physical exercise. Aspirin is one medication that can lower the risk further. The other medications that are widely used to reduce risk are cholesterol-lowering medications called statins, which in high-risk people who have had an event will reduce the risk of another by 25% on average. Now this year, the U.S. Preventative Services Task Force updated their recommendations on the use of low-dose aspirin for primary prevention of cardiovascular disease. And they did this by reviewing a large number of trials, including 3 recent ones. One was looking at moderate risk adults in the ARRIVE trial, one was looking at diabetics in the ASCEND trial, and one was looking at the elderly in the Aspirin trial. Now, these trials, all 3 of them in summary, essentially demonstrated that the risk of aspirin causing bleeding negated the small benefit in preventing heart attacks and strokes. There were hundreds of thousands of patients in the numerous trials that they reviewed, and aspirin was associated with a 58% relative risk increase in stomach and intestinal bleeds and a 31% increase in brain bleeding. The absolute risk of bleeding on low-dose aspirin to begin with is about 0.2% a year and would be approximately 0.1% per year without aspirin. So these are small numbers, but there's no question that aspirin does increase the risk of bleeding, and that's the downside to the medication. Now, the bleeding was much more common in older patients, as you might imagine. I have personally seen ulceration in the stomach, intestine, and colon from aspirin when scoping people that are bleeding, not to mention other sites of bleeding. Now, aspirin is associated with an approximate 10% reduction in prevention of a heart attack. So if you've got a 10% 10-year risk of heart attack, taking aspirin reduces your 10% risk down to 9%, which is what we call the 10% reduction. But of course, this occurs at the risk of bleeding. So what were the task force recommendations? They now recommend the decision to initiate low-dose aspirin to prevent your first heart attack or stroke in adults 40 to 59 who have a 10% or greater 10-year risk. That should be an individual decision between the patient and the doctor. This, of course, would assume a very low bleeding risk. Bleeding risk would be that you would not be taking any anti-inflammatories like Advil, Naprosyn, Motrin, not taking an anticoagulant, and have minimal alcohol consumption because those would increase the risk of bleeding. So the recommendation here in that age group is not a definite one. It's one that should be discussed between patient and doctor, knowing that the benefit is small, but it seems to outweigh the risk. Now, there may be some people in this age group who are worried because of a strong family history of heart disease and who have other risk factors, and they may choose to take aspirin because they're more concerned about heart attacks and stroke than bleeding. Now, the recommendation for people older than 60, the risks of taking aspirin really negate the benefits. And they felt in those that are taking aspirin for primary prevention, there was little incremental benefit of continuing this beyond the age of 75. Now, if you're already taking low-dose aspirin for primary prevention, you should discuss whether you should continue with your doctor in light of these recent recommendations. So let me summarize. If you're on aspirin because you've already had a heart attack, a stent, a bypass, mini stroke, or stroke, keep taking aspirin to prevent a secondary event. If you've never had a first event and you're wondering about taking aspirin, well, if you're in the 40 to 59-year-old age group and you've got a 10-year risk of 10% or more, talk to your doctor about whether the small benefits that I've described are worth the risks in your particular situation. If you have never had a first event and you're older than 60, the benefits really are negated by the risks. This guideline does not definitively recommend aspirin for primary prevention for any group of adults. That's something to remember. The vast majority of specialists who care for people with cardiovascular disease like myself, in general, tell people that you don't need to be on aspirin unless you've had a cardiovascular event, mini stroke, or stroke. It's important for anyone to reduce their risk of a cardiovascular event by getting regular exercise, good quality sleep, eating a healthy diet, losing weight if needed, and optimizing other risk factors. Thanks a lot for joining me today on Medicine with Dr. Moran. I'm Dr. Keith Moran, and remember, get healthy and stay healthy.